Medication management therapy, MTM, is a suite of clinical services provided by a pharmacist to help doctors and patients with their medication regimens, to optimize the safety of their medications and to have better outcomes. So there are three components of medication therapy management. One is identification, one is engagement, and one is intervention. So the identification phase is where a health plan, primarily a payer, will identify a cohort of patients who they believe, or in the case of Part D, the government believes, will benefit most from medication therapy management services. The identification part's the easy part. The second part is engagement. That's a little bit more tricky. In the engagement phase, MTM providers, vendors, need to work to establish trusted relationships with patients and with doctors. And doctors have very busy workflows and significant demands upon them. Patients tend to be cynical about strangers calling them to talk about health issues. So that's a big challenge. And then on the intervention side, once you get that trust and you're able to have the success of gaining the patient and the doctor's trust, having a real conversation about the risks that have been identified and the steps that can be taken to reduce the risk, provide results. But another significant challenge is that historically, since Part D adopted MTM as a requirement back in the Medicare Modernization Act of 2003, it has become over time just a process-driven event. It's measured in terms of completion rates. How many patients are eligible for MTM services, and out of those patients, how many have had a CMR? And plans are measured on process rather than on quality. And that's where the whole purpose of MTM really has been lost. So the enhanced MTM model is a recognition on the part of the government that traditional MTM, which is process-driven, doesn't provide adequate incentives to health plans to really do it, to have them do what MTM is supposed to do, which is drive better results. So in the enhanced MTM program, the government has removed for those plans participating in the 5-year model the regulatory requirements, the completion rates, all of the administrative burdens that have grown up around MTM in the Part D space, and they've charged the plans to innovate. They've said quite specifically, be as creative as you can be and figure out how to make this work. And what work means is to use medication therapy management, the suite of services that pharmacists provide to doctors and patients, to have an impact in therapeutic outcomes. And they'll be measured instead of on completion rates, instead of on process. They'll be measured on reducing actual medical expenditures. And the success of the program will be determined on their ability to do that.